Kavanagh for Dubai Life TV, and I'm here at the American Hospital and I'm joined by Pediatrician Dr. Abed Aydin. Dr. Aydin, it's very nice to meet you.
Nice to meet you.
Tell me a bit about the role of a pediatrician.
A pediatrician today has to think about protection before treatment, has to think about teaching parents how to take care of their children, how to discipline them, what food they should take, what food they should avoid. Also, what are the things that can do harm to their development. Then finally treat whatever their sicknesses.
I've noticed you have the letters FAAP before your name. Can you tell me what they stand for?
That's a fellow of American Academy of Pediatrics. This is a society of board-certified pediatricians that we share with colleagues information on medicine, technology, what do we do as pediatricians, what are the common things that we share on our practices.
So you touched earlier on nutrition for children. So how important is nutrition and exercise for children?
Nutrition, obviously, you don't grow if you're not having enough nutrition or good nutrition. If you take optimal nutrition, then you reach your potential as far as growth in general, especially height, where everybody is concerned about the height nowadays. Also, exercise is important because the body needs to have to grow well, the muscles, and you need to exercise.
What advice would you give to a couple who are soon to become new parents?
I think before they decide to have children, they should know their responsibility to each other first. Adding a child to the family should be a pleasant addition, shouldn't be something that's going to be difficult, make life difficult. So I teach them to give the child whatever he needs, but limit that also what their needs are, because say a breastfeeding mother, the first child, she'd be, every time he cries, maybe she will breastfeed him. But that sometimes needs to be, she needs to be educated. That's not good, because if she spends the night up all night, and then the child is up all day also, then she's exhausted. Then she cannot breastfeed and she cannot take care of that child.
How long do you advise a new mother to breastfeed her child?
The optimal, at least 1 year. But it would be, the breast milk is good for 2 years. There is about 480 ingredients in breast milk, and there's only 70 ingredients could be reached in any formula.
Does the American Hospital offer immunizations and vaccinations to children? And is that different than elsewhere in the world?
We offer all the standard immunization that the Western world offer, plus there are some things that belong to the region, and they are recommended by the World Health.
And what's that?
Something like TB vaccination at birth. Mm-hmm. That is not now required in North America or Europe in some countries any longer, but still here it's required.
Do you get many children with ADHD or ADD, and if so, what sort of treatment do you offer or advise?
If we suspect that we have a child as such, then we refer them to one of our colleagues who has interest in that field. Or if that becomes more, you need more specialized, then we refer them out of the hospital, specialty clinics. They do several screen testing for hyperactivity or autism. And then they give them a few months of observation, and they teach the parents what to do, how to interact with the child.
What's your childcare philosophy?
We are the model for our children. We should try to interact with them. We should be firm on what we learn about, say, nutrition, discipline, and stick with it. And there should be one policy in the house about all these issues, so the child is not confused about what's right, what's wrong.
Doctor, this has been wonderful advice. Thank you so much. It's been a pleasure
You're
to
welcome.
meet you. Thank you.
Pleasure to meet you too.